Hi guys, welcome back. In this video, we will be discussing the third ventricle. We already in the previous video had an overview of the ventricular system. We have the lateral ventricles here, which are present one each in each cerebral hemisphere. These are connected to the third ventricle through the interventricular foramen of Monro. This third ventricle is in turn connected to the fourth ventricle through the cerebral aqueduct. We already saw this in our previous video. We also discussed in detail about the lateral ventricle. If you haven't watched that video yet, the link is available in the screen and also in the description. Do watch it. And now in this video, we will be discussing the third ventricle. Okay, here this is the third ventricle. The third ventricle is the median cleft between the two thalamus. The median cleft between the two thalami is called the third ventricle. Coming to the communications of third ventricle, anterosuperiorly it communicates with the lateral ventricle. As we saw already, anterosuperiorly it communicates with the lateral ventricle through the interventricular foramen. Posterior-inferiorly, it communicates with the fourth ventricle through the cerebral aqueduct. Anterosuperiorly, it communicates with lateral ventricle through interventricular foramen of Monro. And posterior-inferiorly, it communicates with fourth ventricle through cerebral aqueduct. Coming to the recesses of the third ventricle, recesses meaning extensions of the third ventricle. There are 5 recesses: the suprapineal recess, the pineal recess extending into the stalk of the pineal body, the infundibular recess extending into the stalk of the pituitary gland, the optic recess adjacent to the optic chiasma, and the vulva, which is the recess between the fornix, anterior column of fornix here, and the anterior commissure here. The vulva is the recess of the third ventricle extending in between the anterior column of fornix and anterior commissure. So there are 5 recesses: suprapineal, pineal, infundibular, optic and vulva. Coming to the boundaries, the anterior boundary is formed by the anterior columns of fornix, the lamina terminalis, and the anterior commissure. The anterior boundary of third ventricle is formed by anterior columns of fornix, lamina terminalis, anterior commissure. The posterior boundary is formed by the pineal body, the posterior commissure, and cerebral aqueduct. The roof is formed by the fornix, body of fornix, the ependyma lining the undersurface of tela choroidea. This is the tela choroidea. The ependyma lining the undersurface of tela choroidea, and the choroid plexus projects downwards from the roof. The roof is bound by body of fornix, the ependyma lining the tela choroidea, and choroid plexus which projects from the roof. Coming to the floor of the third ventricle, the floor of the third ventricle is formed by the optic chiasma, the infundibulum, the tuber cinereum. The tuber cinereum is the part of hypothalamus surrounding the infundibulum. The tuber cinereum, the mammillary bodies, the posterior perforated substance, and the midbrain. The floor is formed by optic chiasma, infundibulum, tuber cinereum, mammillary bodies, posterior perforated substance, and the midbrain. The lateral boundary is formed by the medial surface of thalamus, hypothalamus, and the hypothalamic sulcus separating the two. That is, the hypothalamic sulcus separating the thalamus and hypothalamus. The lateral boundary is formed by the medial surface of thalamus, the hypothalamus, and the hypothalamic sulcus separating the thalamus and hypothalamus. The interthalamic adhesion, the interthalamic adhesion crosses the ventricular cavity. Coming to the final part, that is the clinical anatomy. Any obstruction of third ventricle leads to raised intracranial pressure in adults and hydrocephaly in infants. Any obstruction of third ventricle gives rise to raised intracranial pressure in adults and hydrocephaly in infants, because in infants the growth of the skull is not complete yet. It leads to increased size of the skull, that is called hydrocephaly. The tumors in lower part of the third ventricle may lead to hypothalamic symptoms like diabetes insipidus, obesity, etc. Coming to a common clinical relevance of the entire ventricular system, the MRI CT study of the ventricles. Here in this diagnostic image, you can see the lateral ventricle, the third ventricle, and the fourth ventricle. The dilation of each ventricle points to obstruction at a certain level. The dilation of third ventricle points to the obstruction at a lower level, that is probably at the level of cerebral aqueduct. The dilation of both lateral ventricles points to obstruction at the level of third ventricle, and unilateral dilation of one lateral ventricle points to obstruction at the level of the interventricular foramen. With this, we will end this topic. For more topics, keep the channel subscribed. Until we meet in another video, thanks for watching. Bye.